For me, it was just, I was an athlete, and like about 2/3 of these guys who do what I do, we're all a bunch of ex-athletes who hurt ourselves and then kind of thought it was cool to figure out how to fix people. And then the role of the team physician for the Omaha Nighthawks is basically to coordinate the care for all the Nighthawk players. One of the most important things we do with the pre-participation physicals is make sure, from an orthopedic standpoint, that all the players have healthy bones and joints. Many of these people have had significant injuries in the past. They've played a very high level of football, and our job is to make sure that they are truly ready to go out and compete. And then along with that, we also have internal medicine and family physicians who make sure that from an overall medical standpoint that they don't have any other medical problems that would limit their ability to compete at the highest level. I spend time every week in the training room. I evaluate all the players that have been injured after the training staff have done an initial evaluation. Some of those players require more urgent care. They require x-rays, MRIs, and such as that. We do see significant injuries, sometimes season-ending injuries. Fortunately, most of the injuries can be cared for by examination in the training room, care and rehabilitation by the training staff, and then we can get the players back out on the field. For the Omaha Nighthawks, we actually have a very extensive medical team that helps take care of them. It includes myself, an orthopedic surgeon specialty trained in sports medicine. One of my partners, Dr. Scott Reynolds, who's also specialty trained in sports medicine, assists me. We have a head internal medicine team physician, Dr. Monny Matthews, who's very experienced and has cared for some of the local colleges and has the most experience really of anyone in the region. And then the person in the trenches every day with the Nighthawks is John Burrell. He's their head athletic trainer, and then he has 2 assistant athletic trainers who are very much involved in the day-to-day care of the athletes. The Omaha Nighthawks are very fortunate to have a trainer with the experience of John Burrell. Myself and my partners who help take care of the Omaha Nighthawks are all orthopedic surgeons, but also are specialty trained in sports medicine, which means we all did additional training specific to sports injuries, the surgical and non-surgical care of sports injuries. And then we're also specialty board certified in sports medicine, which means that after having done all that training, that we've proven that we've continued to take care of athletes and that we've stayed up with the latest treatments and are actively involved in the care of both athletes from a professional level, as we said, all the way down to recreational athletes. There's no question that sports medicine isn't just for the professional athlete. Life really is a sport, and the vast majority of people that we take care of are people living their lives. Whether you're a recreational athlete, a varsity high school athlete, a college athlete, or professional athlete, I think it's very important that if you sustain some sort of injury, that you seek care from a qualified sports medicine specialty trained orthopedic surgeon.